Hello, and welcome to the first episode of the Edgecombe Community College EMS Medical Advisor channel. My name is Brian Kitch. I'm an EMS physician and the medical advisor for the EMS programs at the college. I'll introduce myself in a second, but for now, I want to welcome you to your EMS education program that's I found this channel. If you got here some other way, that's fantastic. I'm happy to have you here. This channel will be used to provide supplemental education to clinicians in EMS education programs of all levels, from medical responder to paramedic and beyond. As a caveat, content here is provided through my own personal lens and may not be completely applicable to your local jurisdiction. Before applying anything from these videos into your academics or current clinical practice, verify the content against your local protocols, procedures, and scope of practice. The episodes coming out will be driven by requests from the college, but also your thoughts in the comments section, so leave me feedback and help shape the education I provide here. For the first episode, I've been asked to introduce myself so that students have a context as to where I'm coming from. I started in emergency services in 2003 as a volunteer firefighter EMT in rural Pennsylvania. I worked EMS in Pennsylvania and New York, doing both 911 and convalescent EMS response. I was a hazmat technician. I also had a fondness for extrication and high angle rescue. I went to medical school in upstate New York and moved down to the Greenville metropolitan area in 2011 after I graduated. I'm an EMS physician and an emergency physician, board certified in both. I work for East Carolina University. You might see me working in the emergency departments in Greenville, Washington, and Nags Head. Additionally, and most importantly, I'm an EMS medical director for multiple counties and community colleges here in East North Carolina. I'm also the EHPC SVET medical director and provide guidance to EECU health and emergency management. So disaster medicine is kind of a thing I love doing as well. Now, this is all to say that my work is driven by a passion for EMS. Every day I'm trying to find ways to improve the local, regional, and national standard of pre-hospital care. Working with folks like you is really the highlight of my career. I was inspired by EMS medical directors I interacted with in my job as a volunteer firefighter. I remember a doc in Pennsylvania, in Williamsport, who just really drove me to be better and to work harder and to always ask questions. And that's sort of someone who I try to emulate. So as we go forward, both in your class and this channel, let me know what kind of questions you have. I can't even begin to keep track of how many things we've changed and improved in North Carolina that was inspired by a question, literally in a venue like this, or a Zoom meeting, or someone just asked, "Hey, doc, why do we do it this way?" And the answers turned into protocol changes. So, sit down with me sometime. I can probably show you a half dozen things easily that we changed because of students like yourself coming to me and asking a random question. Well, that's about all I have for you today. Thanks for viewing the channel. I look forward to delivering content that will improve your practice. Thanks for all you do. Be safe, be well. Kitch out.